Hello, everyone. Thank you for joining us today. We are here to discuss a complex topic of rare diseases and specifically focusing on rare eye diseases in India. We have with us Dr. Muralidhar Ramappa of LV Prasad, and I will do a quick introduction in just a minute. We've got two fathers of children with rare diseases, one whose child has nephropathic cystinosis, and another whose child has mucopolysacchoridosis. Navigating rare diseases itself is complicated, and navigating rare eye diseases is equally, if not more, complicated. A quick reminder to our audience, PatientsEngage is an online platform for patients dealing with chronic diseases as well as their caregivers to share their personal experiences, information, and learn from each other, from healthcare professionals, and the whole objective being that the better informed they are, the better choices they will make. And also when they listen to each other's stories, they will feel less alone and they will feel supported. This session is being done in collaboration with IHOPE, which is Indian Health Outcomes, Public Health and Economics Research Center. This is an exciting collaborative and interdisciplinary research center that has been set up with a research grant from Wellcome Trust DBT India Alliance through collaborations between LV Prasad Eye Institute, IIM Ahmedabad, and IIPH Hyderabad. The key focus of this center is big data analysis, health economics, clinical and public health research in eye health. And PatientsEngage and IHOPE have been working for over 2 years on spreading awareness around chronic eye diseases, as well as different aspects of better research in understanding patient perspectives as well. As I said, we are very privileged to have with us Dr. Muralidhar Ramappa, who's a consultant pediatric cornea and anterior segment services at LV Prasad Eye Institute. His foremost areas of interest include the treatment of visual impairment and blindness in children with special focus to pediatric anterior segment abnormalities, pediatric cataract, corneal infection, and refractive surgery. His interest in corneal grafting in children includes various forms of anterior and posterior lamellar surgeries, pediatric cataract surgery, and advanced intraocular lens implantation in children. We are very, very privileged and grateful for the two fathers who've joined us today. It is not easy for people to talk about what they're navigating on a day-to-day basis, especially when it is rare diseases and complex rare diseases. So thank you for joining us. We have with us Mr. Nirav Shah. His daughter Nidhi lives with nephropathic cystinosis. Thank you once again. And we have Mr. Kalpesh Suratwala. His son Kush lives with MPS, mucopolysacchoridosis. Once again, I think what we can learn from lived experience is completely unparalleled. And thank you so much for stepping up to share your experiences. This session will be moderated by Dr. Shital Patel and myself, Aparna Mittal. From both of us are from PatientsEngage. So today we will talk about the landscape of rare eye diseases, which Dr. Muralidhar will share about, and we will then discuss the lived experiences of the two families in terms of diagnosis and management and the day-to-day challenges that they face, in terms of just navigating things like going to school, support at home, etc. We will also understand the areas of improvement in diagnosis and management of rare diseases, especially eye diseases, and the support needed by patients with rare eye diseases and their families. I think it's important to remember that it's a heavy burden for an individual family to bear, and therefore we do hope that we can continue to advocate for this being treated as a societal challenge rather than just an individual family challenge.
You can talk about, since our focus this time is more rare eye disease, can you kind of highlight what is a rare eye disease and how is that different from an eye-related complication of a rare disease?
Thank you and very good morning. So the rare disease is typically defined as a condition that affects a relatively small number of individuals And often the prevalence threshold is defined by the specific geographic nation. Meaning, in Europe, they have a different definition, 1 in every 2,000 patient population, whereas in United States of America has a definition, 1 in every 200,000 population, that is a normal population. So the rare diseases, as I said, infrequent. Like in a country like us, when we cumulatively add them, it has been estimated we have about 90 million cases to the date, and they pose a significant burden on both family and the society. The problem is that we may not have a conclusive diagnosis in most cases, and so is a treatment. So the rare disease can be defined. One is a rare eye disease and a rare systemic disease. Rare eye disease per se, it primarily involves eye, and a child may end up having impairment of vision or a blindness. Whereas the rare systemic disease, as a consequence of systemic disease, eye get involved as a part of multi-organ involvement. It could be a metabolic disease, it could be a storage disease, or it could be dysautonomia. And some of the most common ophthalmic rare conditions include in our country retinitis pigmentosa, Leber's congenital amaurosis, Stargardt's disease, Usher syndrome again is a part of retinitis pigmentosa, could be a cone dystrophy, including a color blindness, and some of the cornea, that is the front part of the eye, you can have a corneal dystrophies, and dysautonomia, that is a insensitivity to the pain. So these are all some of the commonly encountered conditions in ophthalmic practice. Although there are over 7,000 rare eye diseases have been identified, and nearly 900 diseases have ophthalmic implications. And in India, we have our database shows about 400 ophthalmic conditions which deemed to be rare. And one of the importance of the rare disease is that, it takes a long time to get the definitive diagnosis, and so is the treatment. And many of these rare conditions do not have any definitive cure, and what is available at this point in time is only a palliative cure.
Right, right. So, you talked of how diagnosis of rare diseases is difficult. Can you kind of, describe a typical, and we will come back to the patient stories in terms of, how long it took or how difficult it was. But typically, what is the defined protocol for diagnosis of rare disease in India, Dr. Mundi?
Extremely good question. It's basically, we need a very comprehensive team which involves specialized clinicians who've been trained in a rare systemic as well as eye disease. And we also need a geneticist, we need a genetic counselor, and allied specialty, something like a metabolic specialist, a neurologist. And at times, 3 or 4 of us have to combinedly put our all dots, connect them to arrive at accurate diagnosis. And we may have to order a battery of investigations that will also help us in not only confirming the diagnosis, and ultimately, most rare conditions have a genetic predisposition. So nearly 95% of them. So one of the way to have a confirmatory diagnosis is by molecular screening. That will help us. Once we know the diagnosis accurately, then you have a roadmap, whether we have a cure, or we can only mitigate the complications, or we can halt the progress of the disease. This is how we come with a roadmap for the family as well as for the patient.
Right, right. So, I think we have kind of the background set up. Let me start with you, Mr. Kalpesh. Can you tell us how your son, what is your son's condition, and when was he diagnosed, and what was the early symptom to the diagnosis journey? You're on mute, Mr. Kalpesh.
Yeah, sorry for that. to find any kind of a difficulty in in our child's sight. But as and when he is getting older, like 3 to 4 years, then further around 3 to 4 years, everything was okay. He was diagnosed with, by that particular time, he was diagnosed with the MPS. But as we were not aware of the symptoms, then we have taken it as a granted and only searching for a cure of that particular that MPS. And when he was in a school, he was, as children are very shy, they are not discussing everything with everyone. If they are not discussing things with the parents as well, then
Right.
he came to know from the school itself that he is having a difficulty in watching or in sight problem. Then at one particular time, he was it was like insulted by his teacher. Then we have we had taken that matter very seriously, and we had almost consulted every eye specialist in the city. Or probably nobody was able to find the proper cure, proper surgery for it. Okay. Then we came in touch with the local doctor who was from who has very vast experience in serving at outside of India as well. Then it was found that he took his time, he took his research, and we were suggested to go for a particular DALC surgery, DALC, and referred to go to LVPE. Okay, and it was also found by Dr. Muralidhar that this surgery is well and good for them, and he probably did his best. And currently, my child's sight is far better than what we had expected. It is improving. Earlier, there was some. After surgery, we did. It was after surgery for almost 3 to 4 years. He has continuous reddish eye problem, that is the infectious eyes. And at one certain period of time, it was very frequent. But as and when time progresses, the eye is very much in a good condition as of now. And
Right.
currently is having no other issue, but no other eye issue actually. Other
Right.
issues, other symptoms are still continuing, and health is deteriorating. This is what I wanted to say.
Right. Thank you. Thank you, Mr. Kalpesh. Dr. Murali, just to clarify, right? So, Mr. Kalpesh's son has MPS, and you can tell a little bit about MPS to the audience, but also, do all people with MPS have similar eye issues, and should they be watchful for that as well?
Yeah, thank you again. Mucopolysacchoridosis is nothing but a metabolic storage disorder. You have an abnormality in one of the lysosomal enzyme, which normally degrades aminoglycans. These are all the building blocks of our entire human body. To the date, there are about 9 different types of mucopolysacchoridosis. So in our case, Kalpesh's son's case, it was a type 6. So except type 2, whether all the types have a corneal involvement, and in his case, he didn't have a glaucoma, and he didn't have optic nerve issues. It was primarily a corneal issue because of a corneal clouding due to deposition of this aminoglycans. We call it as a gag. So that's actually, impairing his vision. So what I had after ascertaining his optic nerve status, intraocular pressure, and also child's, in a type 6, the child have a normal cognitive functions. Unlike in a severe type 1, where child have, very severe cognitive, delay and a lot of intellectual disability. Since it was a type 6, it did have advanced skeletal changes we went for a simple, lamellar corneal transplantation, meaning, the opacified cornea was replaced, and following the lamellar surgery in both eyes, his vision has significantly improved. So that enabled him to, go back to his schooling, able to, mingle with his peer group, able to see the board and perform in his school activity.
Right.
And we do expect, certain ophthalmic and systemic complications. So, which is a lifetime condition we have to deal with along with the family, So, any consequences which have been clearly explained to the family. So, we are prepared to, do that.
Right. And is this the typical age? Like he said, his son was about 3 or 4 when they started spotting the issues of the eyesight. I mean, it could just be because that you're school going and you start to observe that there are issues, but is that the typical age for most MPS patients?
Yeah, great question. I think it's a typically 3 to 4 months is a time where parents recognize, babies' corneas are not normal. When they're born, when they're born normal, and as the child, evolves, 6 to 1 month is a typical time where they see a coarse facial features and gradual transformation of, cornea into little more hazier and opacified. So it will start from 6 months onwards. And if we diagnose, within 6 months time frame, and if we confirm, which type of the MPS we are dealing with, we do have some of the curative therapy for mucopolysacchoridosis in the form of a gene therapy, in the form of a hematopoietic stem cell transplantation, and also enzyme replacement. So enzyme replacement typically works if we identify case within 2 years, whereas the hematopoietic stem cell does work if we identify child within 6 months. During my training period in America, I have seen, children who have had, early enzyme replacement or hematopoietic, they look normal like you and me. So one of the, I want to reiterate here and emphasize, so if we recognize MPS very early, so we can actually cure MPS. That's a good news.
Right. Thank you. We'll come to you, Mr. Nirav. If you can talk about your daughter and, what were the early symptoms and the journey to diagnosis as well. अगर आप हिंदी में बात करना चाहते हैं तो आप हिंदी में भी
नहीं, no problem.
Whatever.
My daughter is Nidhi, is 17 years old. She is suffering from nephrotic cystinosis, proximal artery and hypothyroidism. This diagnosed by after 7 years in AIMS hospital. In nephrotic cystinosis. Our journey is very hard. We are going to many places, but not diagnosed. Generally, Gujarati people is going on Bombay and is a last destination.
Right.
Just one hospital or and etc. But I thought something is wrong, so I will go to AIMS, and AIMS identifying in 3 to 4 days in by eye evolution, it is a nephrotic cystinosis.
Right. So in the meantime, till you got to AIMS, do you know how many doctors you saw, how many specialists you saw, how many tests you did? Koi approximate number?
Many, not
many.
Not calculated away.
Not calculated. Okay. And when did you start seeing eye issues for your daughter?
See, 3 to 4 years, and we are going to outside. So her eyes is shrink. Shrink in.
Sorry, her eyes is?
Shrink means वो सिकुड़ जाती है जो बोलते हैं ना.
अच्छा, shrinking. हाँ,
shrinking.
Right.
In solar. So many doctors I will go to, but this is but natural. So I did not find, and she is trouble from sight also. She did not see in school boards and etc. So I am going to ophthalmologist, but she is not a support. It is a photophobia, so she is not support. So child is not support they wrote and we come back. So we go to AIMS, and AIMS is identifying second opinion to Muralidhar sir, and
Right.
they totally, I check in one day. Any place I will go, and बोलते हैं ना कि निराश होके वापस आता है. And then one day totally he can give evolution.
Right.
Yeah.
And by then you already were aware that your daughter had this rare disease, right? Or were the eye issues before the diagnosis of her condition?
Before diagnosis, she is 9 months. Is a polyuria and vomitings. So we are admitted in local child specialist. Then she vomiting is closed, but polyuria is continued. Then I will again going to there. So he says, but this is a natural. One day 15 to 70 times urines, and night is 5 to 7 times urine. So
Right.
I like it's something wrong, and his body is also be collapsed, and his growth is retardation. So I will go to other doctor in nearest to Padra in our nearest village. She diagnosed is a TB, and 1 week we give a TB treatment, and doctor says the TB is not like, I go to further his superior doctor. Then
Right.
we go to there, and a doctor one day going there, and he made of weight, and one day leaves, and see other further we going to there and weight. So both weight difference, she like is something wrong. So she admitted to 26 days in Kasi Children Hospital.
Right.
And they diagnosed she is a problem of the kidney and with genetic diseases also. But genetic disease is not identified. First they like the diabetes insipidus, and they 3 months we get to pump in nose, but urine ratio only 5 minute delay, not more. Then we going to genetic specialist. They send me genetic specialist, and genetic specialist diagnosis of renal syndrome. But renal syndrome gene mutation is not meet that. But they say clinically renal syndrome. We go to nephrologist, and nephrologist start milk, and she's like milk is patient supported, not is adverse reaction. So it's a diabetes. So it is a Fanconi syndrome, and then we are really started to nephrologist, and nephrologist is controlled to only only calcium, potassium, phosphorus, sodium, metabolism, जो means यूरिन से जो निकल जाते थे वो कंट्रोल करते थे. हाँ, but I like something is wrong. So we are going to 5 years after, with total 7 years, we are reaching AIMS, and AIMS is diagnosed. It is Fanconi syndrome with nephrotic cystinosis.
Right. Okay. So yours was quite a journey. Dr. Murali, is that common? Is that, how can this journey be improved? And also, I think he talked of how even when they took the daughter to ophthalmologists, they did not, kind of recognize the issues. So if you can comment a little bit on the challenges of diagnosis as well as the entire journey to diagnosis in some cases. And I think it's quite typical of most people with rare diseases actually in our country, unfortunately.
I think it's one of the exceedingly rare condition have autosomal recessive, pattern of inheritance. This particular disease entails metabolism of the cysteine, which is one of the important essential amino acid, again, a building blocks of entire human body. This is the protein, it helps in protein formation.
Hmm.
There is a defective gene, so which related to the defective protein, and we typically call it as a CTN gene, which is related with the carrier protein for this amino acid. When you don't have that carrier protein, you have a free plasma cysteine. So when you have cysteine is in a free state, which tend to accumulate everywhere. So whatever you described, these are all complications of this metabolic conditions. So therefore, somebody who's really trained in this condition will not be able to pick up. As you rightly said, it was diagnosed as a diabetes insipidus because she had a frequent, urination. She had little changes. They labeled it as a, kidney abnormality. And she had, also misdiagnosed as a tuberculosis. So normally, children with a rare condition, not every clinician, see, there are 90,000 genetic conditions. It is
Right.
impossible to know every, conditions as a clinician. So unless you are trained, I may be able to pick up about 400 conditions. Even I may miss several conditions. So in this, by typically 1 to 2 years, as rightly Nirav told, the child started, having squeezing her eyes. What he meant, she is making eyes small. She's squeezing her eye. Why does she squeeze? Because these protein secretes in tears of the child. They get deposited on the corneal surface. They form like a needle. So
Right.
she'll have pricking sensation, she'll have a watering, she'll have unable to tolerate the sunlight. So that's what the symptoms, when those symptoms were pronounced, he started visiting, eye doctor and several hospitals. That's how ultimately, disease was picked up.
Right.
Sometimes, in a very early course of natural course of the disease, unless we have a complete information about family, pedigree, does any other family members have this disease, the parental consanguinity. There are so many things, when we construct diagnosis, systematically, maybe,
Right.
that link was missed. So therefore, it took a long time, maybe 3 or 5 years in this girl's case before we had a complete diagnosis. Yes, this disease, although doesn't have a complete cure, but we can actually mitigate the side effects, complications. Unfortunately, this child has a severe form of cystinosis. So having, the Fanconi syndrome is actually after effect of a cystinosis, where it does affect the multi-organs. Your kidney got involved. Of course,
Right.
that's the system, and so is the eye. Fortunately, in eye, it is only affect the mainly cornea, and that can be, taken care by using a drops called a histamine. So
Right.
unfortunately, this is an orphan drug which is not available in India. He has to procure it from the France, and I think, it is quite expensive for any family to, get them, frequently. So that's how, the Nirav Shah's family journey about.
Right. Right. Dr. Shital, you have any follow-on questions?
I just wanted to ask Mr. Nirav, आपकी बेटी कितने साल की थी जब उनको ये आई का प्रॉब्लम्स आप बोल रहे थे ना, श्रिंकिंग और स्क्वीजिंग वगैरह?
यस,
वो कितने साल की थी तब?
3 to 4 years that started.
अच्छा, और टीचर ने आपको बताया ये कि आपको घर पे भी दिख रहा था कि वो रब कर रही है आईज या कुछ?
नहीं, हमको घर से ही पता चल गया था, क्योंकि हम कहीं भी बाहर जाते थे तो आई स्क्वीजिंग हो जाती थी, स्क्वीज आई। तो हमको लगा कि इसको आइस में भी कुछ प्रॉब्लम लग रहा है, क्योंकि इसको रेनल रिकेट्स भी बढ़ रहे थे, आइस में भी प्रॉब्लम था। वो 2.5 से 3 साल तक तो चल नहीं पा रही थी। हाँ, उसका हाँ, तो चल भी नहीं पा रही थी। तो हमने आई स्पेशलिस्ट को भी कई जगह पे दिखाया, बट शी इज नॉट सपोर्टेड के वो लोग भेज देते थे वापस।
ठीक है, ठीक, ओके, थैंक यू।
एंड आप दोनों के केस में बाद में आपको पता चला कि कोई फैमिली हिस्ट्री है या किसी और को, कई बार पहले नहीं पता होता, देन यू गो बैक एंड चेक एंड देन यू आस्क अराउंड एंड somebody says yeah, there was somebody in the family who had it. So, आप के case में या in your cases, were there any such incidents that happened later that you found out that there was a family history?
Actually, I checked my family history, but nobody seen.
Nobody.
No.
And Mr. Kalpesh?
Nobody. In my case as well, nobody is there. And we haven't found a single incident in our whole family tree then. So it's the first time ever case.
Right. And in terms of, did you, because it's a genetic condition, etc., did you ever get referred to a genetic counselor? Did you talk to a counselor at any point, a genetic counselor? Either of both of you, Mr. Kalpesh and Mr. Nirav?
Yes, I did. I did one of the renowned genetic counselor. But at that particular time, it was the first priority was to diagnose with what kind of a disease it is, and then whatever is there, whatever the possibilities for the cure. So we did that thing, but at that particular time, it was not possible. Nowadays, there may be some cure, but not sure about the actual result. So at that particular time, I did that thing.
Right. And Nirav ji, did you talk to a genetic counselor?
Arvind Bagga sir said then final.
Sorry?
Arvind Bagga sir, nephrologist, pediatric nephrologist, he said that's final. We are not counseling to others.
Right. Okay. So I think coming back to, understanding, so obviously it's a rare disease. There are certain treatments available or supportive care options available. So if both of you can talk about the management of the condition and how you've been dealing with it. So Kalpesh ji, if you can start with, what are the elements that you have in your control and that you can manage, and what are the gaps that you see?
Probably if we are talking about only eye disease or eye part, then
you can talk of eye and the rest as well. Don't have to restrict it to only that.
Okay. So in this particular case, what I can say that the eye part that was already cured, I believe that, and I believe that there is no further any kind of discrepancy in eye. It is probably working very good. But if I'm talking about in general in other parts of the body, then what I can say that everything else has no proper cure or solution as of now for me. Like he had an umbilical hernia operation already.
Right.
He had that thing, and he has a muscular problem. He cannot hold the things. He can only hold a pen as of now, which he was doing since the beginning. Okay, so it is very difficult. He is having a walking difficulty. Cannot walk on a flat foot. He has to walk on his toes and fingers only. So these are certain parts. Apart from that, he is also having a heart problem. Like it is only working for 50% only as of now, and condition will be worsened day by day. And in upcoming future, we will surely need to operate that thing also. So I think till the date only whatever happened, so it only eye conditions can be managed, can be cured, and with the sure shot help by Dr. Muralidhar only. Otherwise, there is no other option. Even if we had tried to consult and get a consultation from the other doctors, but there is no specific solution for it. That what you should do for this. Even a physiotherapist have given up. Homeotherapy doctor has given up. So everything is at a condition. There is no improvement in a condition unless and until there might be some ERT or BMT option is there. So otherwise, it is. If we are still figuring that thing out, we are not in a position to find out a cure or not able to manage rest of the body. Rest of the body.
Right. And Nirav ji? Sorry, I can't hear you.
Its condition is presently good, but creatinine was increasing. We are nearest to dialysis, and eyes problem will also be increasing state. but might be controllable. Her sister drop, we sometimes yearly 2 or 3 drops I will purchase, and after I will making that drops some manufacturer. But their drops last time that they make, that's not good became, and his eyes pressure is increasing. I measured that, I observed that, so we stopped that. But presently we yearly 1 or 2 cystadro purchasing in France, and we manage. And his kidney control cystagon tablet we purchasing by USA. Then manage. This is actually rare disease, is a costly rare disease we बोल सकते हैं. Is a costly disease. But try to manage. And its condition is good. We see 2 to 3 years he is not walking and pottying, all things in recede at that place. But presently is going to school. His bag not carrying. वो हमको check के जाना पड़ता है, लेकिन but condition is too good.
Right. So both kids are able to go to school and continue their studies.
I have the same condition that I need someone to carry his bag. This is an everyday scenario. Even school is fed up with this thing, but somehow they are managing actually.
Right.
In one escort with child is continuous.
So throughout the day in school, or only to drop them and come back?
Actually, first 6 years we are going and staying there, but still we are not seated with her.
Right.
So I had a question along the same line. How does everybody in the family share the responsibilities of care?
His mother is very sacrificing.
Of course. Okay. And do you have other children who help?
Yes. He's a small brother.
Okay.
He is very caring her. Her height is small, like 7 years. He's a 17 years, but like 7 years. But her brother's height, he is 11 years old, and he is caring her. If both anybody going, तो वो साथ में जाएंगे और उसका केयर करेगा.
Right.
And Mr. Kalpesh, आपके घर में कैसे सब share करते हैं responsibilities?
To be very frank, everybody has given up except me. I'm still trying whatever possibilities are there, but that's fine. मैं अपनी तरफ से जितना हो रहा है उतना मैं करने की कोशिश कर रहा हूँ. Otherwise, I don't think so कि भाई कोई इतना इंटरेस्ट लेके उसकी हेल्प कर पाए, because he has also given up and he has taken it as a granted that this is a life and this is all going to happen with him. And I've shown him all scenarios, what are the best possibilities. He is also at that particular age that he can understand the things, that what is happening with him. He knows everything. And I had only one child policy earlier, but just to accompany him, we had came together for another child. And छोटा होता है तो और बदमाश होता है, वो उसको और मारता है, बस और कुछ नहीं. So that this is happening, and I'm only trying as of now at my level. I'm only
trying. Right. And did you ever consider counseling, psychological counseling to help the family deal with the emotional aspects, for you to deal with, for the child to deal with, for the entire family? कभी किया कुछ psychological counseling? No,
never.
और आपने अपने बच्चों को कैसे समझाया ये डिजीज के बारे में कि ये हुआ है कब बताया और कैसे बताया?
हाँ, यूँ समझिए कि भाई मतलब एक पर्टिकुलर एज जब उसके स्कूल्स के ऐसे सब्जेक्ट आने लगे होते हैं, दैट पर्टिकुलर मोमेंट आई नीड टू, बिकॉज आई नीड टू शो हिम दैट whatever whoever you are studying with have this ability, they are normal, they can be do this thing, that thing, but you have this certain type of disease and you cannot manage on your own. You need someone's assistance for this. So I would simply tell him to Google what is this disease and what is happened in this disease. So he's very much phonetic. So he did all the research, and I already told him that this is ultimate. This is what ultimate is going to happen with you as well. This
Right.
is
So
I
how
was,
old was he, Mr. Kalpesh? How old was he that he was able to Google it himself?
and that is he was I can say around 8 to 9 years
Okay. Okay.
at that particular time, and currently he is 13.
Right.
So and he knows everything. That this is the problem, and even he has accepted the problem. The main only thing that is demoralizing him is his surroundings, where other children are making fun of him or cannot accompany him in lunch or studies, just uh, uh, to be friends with him for their own selfishness. That's it. Otherwise, nobody is accompanying him in any kind of a study or any kind of even school games. Nobody wants to accompany him just because of this physical disability. So everything is fine. I've told him to leave alone. I've explained him how he should take his life, enjoy his life actually.
Tough, no? Tough for him also, for all of you all also. Right. And Nirav ji, do you have anything to share on that? When did you tell your daughter about it?
I one time was told your kidney has a problem and eyes has a problem. She is also महसूस कर रही थी वो भी कि आईज में थोड़ा प्रॉब्लम है, बट वो तो क्या है कि समय के साथ यूज टू हो जाते हैं बच्चे. तो she is used to his class is a separate bench, small separate bench given, and her friends also we become in new school. So
Right.
तो समय के साथ यूज टू हो जाते हैं बच्चे भी.
और वो कितने साल की थी जब आपने बताया, नीरव जी?
वो 12-13 साल की थी तब बताया था.
बट अंदाजा तो पहले हो ही जाता है ना, सो इतने सारे डॉक्टर्स के विजिट होते हैं,
yes.
you're seeing
Many
doctors, you're hearing some conversations.
Yes. Yes.
Right.
और स्कूल से कोई
Go ahead.
सपोर्ट मिलता है आप दोनों को? स्कूल से क्या सपोर्ट मिलता है कि कुछ नहीं मिलता इतना?
Somewhat support we are getting from school as well. Like the main support is that only that they simply tolerate their mischief and everything. If their school bags are heavy, they are helping them to carry this to their classroom.
Okay.
These are the basic supports that we are getting from school, because school understands it, but not the other children. They used to keep distance with this kind of children. So this is what happening.
तो सोशली कोई नहीं सपोर्ट, सोशली सपोर्ट नहीं मिलता स्कूल काउंसलर से?
difficult to find. It's difficult to find. Yes, it's difficult to find, because ultimately it is the parents they are the parents who are going to give their children this kind of information or everything. But if the children are very much mischievous, then they are not taking this thing very personally or seriously. They are simply going to make fun of this thing. So if parents provide proper information that they should not do do's and don'ts like things, that should be done from the parent side only, and not teachers. Teachers are on a duty on a particular time only. So it is going to happen. So ultimately children or a surrounding company which is going to make difference.
Right.
Suppose if you are getting any kind of a moral boosting, then also you are going to take some physical, going to do some physical activity. And if you are not going to be supported, if you are not going to be accommodated, then you need to sit in a corner only. If you are sitting in a corner, you are not going to do any kind of activity, and ultimately your health is going to deteriorate. That's it.
Right, right. Dr. Murli, you wanted to say something?
Yeah. So I really thank Kapelesh and Nirav. Not only you are doing this one for your own child and family, you're really helping hundreds of people out. And I know both of you, I can see visibly how emotional you are. This has been a roller coaster journey for you ever since you have had child. I have a very honest question for both of you. How did you accept yourself? Your own acceptance is a matter even before you try convince, your wife, your parents, your in-laws, and ultimately child. So tell me how difficult it was seeing your own child in front of you suffer, where you come to know with many doctors there is no treatment, right? It's a downhill course. The children's, in front of your eye, they're deteriorating day by day. So how difficult it is to personally to both of you to accept that fact.
If I'm talking about myself, then I mean, I want to share one simple thing, that everybody has a name, and every name has some kind of a meaning. Like my name is Kalpesh. When I Google it, that what is the actual meaning of my name, then I came to know that my name means Lord of Perfection. Lord of Perfection means the person who cannot tolerate even a single, that is वो बोलते हैं ना 19-20 का फर्क भी नहीं चला. Suppose if there is a salt issue in my food, then I cannot tolerate it. And I am tolerating all these things with my child as of now. It's not a 19-20 difference. It's a difference of 0 to 20. So I'm doing all these things. It is quite difficult for me to manage because I haven't tolerated a single difference or single kind of a thing in my whole life. That is for sure, and I'm very much confident about my history because I used to scold my wife as well. Suppose if I find something wrong with my food or with if books are not kept properly or if anything related to, because I need everything in perfection. The problem is that I am living with that kind of an imperfection, my child's imperfectionity. That this is what happening, and I'm tolerating all this, and it is next to impossible for me. But I'm still trying to, as I need perfection in everything. It is difficult most difficult part for me is I need to watch my child in this inability or in disability. This is the main thing, because what a normal person can do, it is also a difficult task for my child. It is not about achieving something more than a normal thing, but it is about achieving a normality, which is a difficult for me. So this is very difficult part for me, and I have taken it very personally, and I will do it till the end of my life. Will do it.
Thank you. So thank you, Kalp. So what is that which gives you solace when you interact with so many people, as was Aparna madam was saying, you need a counseling, support groups, and a variety of, doctors. What does that give you at the end of the day, solace? सुकून किससे आपको सुकून मिलता है? When you deal with all, or when you confront with so many challenges, what is that one thing which give you some hope? Now the reason I'm asking, as a clinician, even I want to be more empathetic, more sensitive, to make sure, I would give ability to provide that solace to the family.
It's the way, yeah, Mr. Nirav, please go ahead. Please go ahead. Nirav,
my daughter playing and her smile, we are enthusiasm to work hard.
Excellent.
But coming back, we'll hear Kalpesh ji, you first on this answer, and then I do want to hear Nirav ji's, kind of answer to the earlier question of Dr. Murli as well. But आपको किससे सुकून मिलता है कल्पेश जी?
There is it's only thing that at the end of the day, if my child is asking me for something, and I immediately order it from whatever sources I have, or if he is asking me that I need this thing or if I need that thing, so anything, if he puts finger on the thing, that I will give it to you. That's it. I want you live before you leave. This is what I've already told him. So he always asks me that why you never uh, uh, why you never say me no. I this is my only simple one liner that I want you to live before you leave. That's it. And his favorite thing is food only. His favorite thing is food. I want him to enjoy his food. If he wants something, if he wants laptop, he can get it. Anything he wants. He is having his own personal mobile. He's having his personal laptop. Everything is at this age. Live before you live.
Aparna and Shital, I've interacted with this boy several times. He's very positive boy, very, very happy. And I've asked him, what is your dream? His dream is to see the world. He wants to travel as much as possible. Kapilesh, are we helping him?
Yes.
Yeah, I do my contribution for that. Will at least, make him happy, give him a quality life. Okay, we'll give a extremely good farewell to him.
Actually, he is able to see the world. Reality is a different thing, but at least he is able to see the world.
So
that is
right. So coming back to you, Nirav ji, how did you accept this? I know you said आपको सुकून मिलता है when you see your daughter playing, but how did you accept?
Actually, our life goal is his life is how we give better. This one word, how we can give better, and accept करना ही पड़ेगा आपको कि जो है वो है.
Right. And if you had to change one thing, right, based on your journey, what were the one thing or three things that you want changes in the medical system or in the healthcare system? What would you want to change?
Genetic rare disease identity is very tough in India. Present condition is improve day to day. But I thought medicine is not available in India. So India has also made in India medicine will also go to world, and our MPharm student we use and we make also be here R&D works and that we involve in MPharm student. I find pharmacoscope. I find a formula of the cystinosis by one MPharm student. He give me a formula, and then I want to make. And some Canadian hospital also make that form only system and hydrochloride and percentage of NaCl mixing, and they put eyes and they save the eyes. Canadian some hospital give directly. That time much research, but presently is much research, and jelly also be start of jelly also be made. Then India also be hospital. I thought if India hospital also be provide that is use the MPharm student and also became India also, and India supply to world.
Right. Dr. Murli, we've talked only about two rare diseases at the moment in today's conversation. And I know you've talked of the various types of treatments options available, but if you can kind of quickly summarize, rare eye diseases are in general treatable, or are there newer treatments on the horizon that people should be aware of as well? So you can kind of shed light on that.
Yeah, again, a great question. So availability of the treatment, again, based on a type of, either a rare eye disease or a rare systemic disease. So if we can recognize some of these diseases at this point in time, 5% of the rare conditions, which may be including systemic, if we can do a timely diagnosis, we would be able to not only mitigate all the consequence of this disease, and good news is that some of the disease can be curable. One such a disease is the MPS, which a population we talked about. If we can recognize within 6 months, you have something called as hematopoietic stem cell transplantation. Within 2 years, we can plan something called as the enzyme replacement therapy.
Right.
There are several ophthalmic conditions, something like retinitis pigmentosa, and we also call it as an LCA, that is called Leber's congenital amaurosis, which is again as a genetic problem. It is an autosomal recessive condition involving, we call it as a RPE65 gene. It is commercially treatment available in United States, Luxturna. It is prohibitively expensive. I think if we can identify this disease and start early treatment, we can actually, mitigate a lot of negative consequences of retinitis pigmentosa. Retinitis pigmentosa, as you know, it selectively involves the photoreceptors of the retina.
Right.
And the second or the third decade, patients start slowly losing vision. They become blind. So that can be mitigated. That can be delayed. The onset of disease can be delayed by using some of these specific gene replacement. What exactly in a gene therapy we do is that, we replace the defective copies of a gene, which is actually responsible for, it is basically a message for, small cytoprotein, which helps, give, signals for certain metabolic pathways.
Right.
That's a good news about. And some of the corneal condition, currently we collaborate with the University of California. And we've got a FDA approval for the clinical trial. We've completed our animal trial. This is called a congenital hereditary endothelial dystrophy. This again manifests within 6 months of birth. And particularly, it's very common in South India because, culturally, we tend to, have a lot of parental consanguinity. So this has, good, therapy now. I'm sure in about 5 years from now, even this condition can be easily, nearly curable. The term is curable. We are not making them normal. We're at least delaying the, the disease per se. So likewise, there are a lot of enzyme replacement. At least there are 10 conditions at this point in time. We can partly or nearly cure them. And the remaining, as I said, 5% of them, as in cystinosis, we can delay the complication by using some of the molecules like a cysteamine. So the cysteamine hydrochloride, where Nirav is saying it's an orphan drug, which is not easily available in India, and this has to be imported either from Canada, America, or France. Okay. The why Indian pharmaceutical company are not keen, because it's commercially not viable. Since not many people, want this drug, only a select group of people want it. So I think government, at advocacy level, if they can support these orphan drugs, one of the way we can, support these families, provide them free of cost. I totally agree, Kalpesh. When it comes to rare condition, it should not be the family's burden. It should be, the societies, it should be the country which have legislation and, things in place to ensure that, these families and children are taken care well.
Yeah. Yes, Kalpesh.
I have a question from Dr. Muralidhar that you said that MPS can be cured if it is found diagnosed within 6 months to 2 years. While in our case, we were told that I should let the child go away. So when did you came to know about this, that it can be cured
Well, this treatment
this particular time?
I'm sorry about Kalpesh in your case. This treatment available, for the last 12 years. So it is initially started in Pittsburgh, where I was trained. And in India, South India particularly, CMC Vellore, St. John's, and recently even in a couple of centers in Hyderabad, we started doing the enzyme replacement. When I had seen your child was already 7, I believe, when I first met you people. Yeah. So I didn't
When you met,
advise. Yeah.
he was around, yes, 8 years, around 8 years.
Yeah.
Okay.
So then we lost that, and we missed that bus, that opportunity. You have a small window of opportunity where we have to go and do that, intervention. In your case, yes, we missed it.
Okay. So currently there are no possibilities, right?
Yeah, we can't
Or
reverse.
can we take a chance?
True. We can't reverse even if we do that. There are already a lot of metabolic changes have set in. Unfortunately, we can't reverse. Because, I've witnessed myself, there are, patients in the US, they were in teenagers. They were looking like you and me. There were no changes. Okay. So their height was normal, their facial features were normal. They were all treated, when they were very small. At this point in time, I understand, these sophisticated treatment modalities are pretty expensive. Not many centers are capable of doing. At this point in time, I went to, one of the websites from the government. So they have recognized about 8 centers of excellences across the, north to South India. And these are the centers, some of them are capable of dealing with, each specific condition. No single center can have a treatment for all type of diseases. It's basically clinician driven. See, I know much more about, eye involved rare conditions. Similarly, somebody else may be, good in metabolic conditions. Okay. So we have to approach a center and a person who has that expertise. And above all, key is the time. We have to have that.
That is the main thing. Yes. That is the main.
And that is tough for families to figure out, right? As well. So unless there is clear documentation against the centers of excellence on the website saying they focus on XYZ, it's really difficult to navigate and figure out whether they should go to, AIMS or go to KEM or, whichever.
Absolutely. Ma'am, I have, I'll just recollect one experience. My child was born in US when I was doing this, rare eye disease training. Where, they screen my child, despite, it is a healthy child, they screen every metabolic conditions. So they performed a battery of 150 tests. Me and my wife, we were so uncomfortable. They drew 10 ml of blood from a newborn, day 1 old born, and they ruled out all possible things. And of course, we have to pay for that entire thing, about 10 or 15,000 USD. Not every family can. But in India, Kapalesh, at this point in time, unfortunately, we don't have that, considering our population and, doing molecular screening for entire thing may not be technically feasible. It takes a time. I think things are improving. Maybe in about, like efforts like us, if we can, can help make the, planning and changes at advocacy level, can, at least for a future generation, there is a good hope.
I think in some of these countries, they're also doing pre-pregnancy kind of testing.
You're right, ma'am. You're right. Right from the.
I think certain these stem cell companies are doing umbilical cord screening, and they're doing, these are the storage facilities that do that. And I think, like you promptly said, that timely diagnosis can prevent a lot of the disease manifestations, ocular in these cases. So that diagnosis has to be really on time, and I don't know how we can make sure that happens for everybody who's got a rare disease or a child with rare disease.
I think, the centers which equip with a genetic counseling and a geneticist, when you have, 95% of the rare diseases have genetic, as a predisposition. Okay. You have either from a family or it can be sporadic. And is these two families, there is no family history. It may be a just spontaneous mutation in these children itself. So that's possible. Okay. So need not to be, other members have to have the disease. So this can be this child alone. There is a just mutation, change in the gene copies, or there is a defective genes. So that would have explained, the disease per se.
Right.
Yeah. So the genetic screening is a way to go. I'm sure we should be able to pick up the disease by doing a genetic analysis at very, very, very early, as
So-
soon as the child manifests.
Right. So, Dr. Muralidhar, since both the fathers here today have younger children, were the younger children kind of tested?
I don't know. I don't remember. Kapilesh and Nirav, can you just? I think I've seen Kapilesh's younger child, I think is normal. So I think
Yeah,
Nirav
it's
also.
normal. We did CVC. We did CVC, something like that. Some report was there, and after that we went further in that for the childbirth.
Right.
Okay, right.
Yeah, that's a
And
great
Because
point.
if a similar kind of a problem is detected,
Hmm.
CVC reports are there, no? Some CVC reports. Yeah, we did that thing, and before 5 weeks, something like otherwise the government won't allow you to abort that child. So we did all these things, and it was found that everything was okay. Then we move forward in that particular case,
Right.
and just to accompany the elder one, just to accompany the elder, so that he can get a company like he was. He's being ignored in his school. He should not be ignored at home. So he need a company, and that is quite worth. I believe that at least he can have a company. He can live his life. So it's fine. I mean, it's fine.
Yeah, Shital, I just want to, touch upon one important point here. So what we do is once we establish, molecular diagnosis in a child, affected child, then we go back, do a Sanger sequencing of the parents. Do the parents are a carriers or not? If the parents are a carriers, and if it is autosomal recessive, then we also do a family genetic counseling. Look, parents, you both are carriers, and your next offspring, there is a 25% risk that, the next child may have a disease. Same is a carrier status. Our idea at, IRED, that is the Institute for the Rare Eye Diseases and Ophthalmic Genetics at LV Prasad, we don't want any family to have a second child with the same issue, same
Right.
abnormality. That is our biggest initiative. So we do this extensive family counseling and help the family to make both informed personal as well as a medical decision. See, you have this disease. If you plan a next child, there is a 25%. Do you want to take that risk? We help them make that decision. Yeah, in a certain cases, yes, there is a precious child, one is affected, family is desperate to plan second child. We have to help them. As you rightly said, I do then prenatal screening and see that next baby is free from disease. Then only we allow the full pregnancy and have a child, born. So these things are, effectively being done in many centers. I think Kapilesh has a point. Please, Kapilesh.
Yeah, Kalpesh
Yeah.
was trying to.
We do not have any kind of a family history, but we did our genetic report, and I just found that I am a carrier. So this is not happening, but this is what when you got something worse, then you came to know that this is happening. So in future, it is better to match this thing first of all.
Absolutely.
This should be made quite common if we want to give our child a better future. This should be made common.
Okay. I think we've had a very detailed discussion. We've covered on various aspects of managing rare diseases. We've talked of clinical aspects. We've talked of psychological aspects. Any final words from each of you to the audience? We'll start with you, Kalpesh. So, any parent or patient who's listening to this, or a doctor who's listening to this, what is your final message?
my final message is very simple that you should never ignore your child's condition. Whatever, one more point I just want to raise over here that probably just before my child was diagnosed with heart problem, my wife detected that he was not at around 6 to 7 months only. The age was my child age was around 6 to 7 months. My wife observed that he at that particular age, if we are holding a child in our hand, even at that particular time, he was not putting his foot on the floor. He was simply putting it only on his toe and front fingers only. So this is what at that particular time we have. But my wife has already observed that thing. But it was very in general term that okay, it's just a newborn baby who is going to take care of this. It is going to be okay as and when time passes. But this is the main that if we did at that particular time, which is very uncommon thing, if we did that thing, so this situation can be prevented. So it never take this thing lightly in every aspect. If you find it, go for it. That's it.
Right. Nirav ji, any messages to whoever is listening?
I go for Kalpesh, right? Actually, never.
Sorry, can't hear you.
You find the symptoms. Never ever to symptoms and go to doctor first. Sometimes we save the money and never go to doctors and take the precaution in home. So sometimes it's late. So go for, first you have find minor, not ignore, and go first doctor.
So don't ignore signs and symptoms and get a diagnosis as early as possible. Thank you. Dr. Murli?
Yeah, one of the messages for the families is that, if you have a rare eye condition or a systemic, so your child still can have a fulfilling lives. So with right kind of a support and intervention, it is important to focus on, child's ability and provide opportunities to lead life independently and very happily. So you do not have to, completely spell out negative consequences of a child when the child is so, fragile, tender. We don't want to burden them by, conveying entirety. Okay. And seeking help from the appropriate, center of excellences, and also connecting with the parents and a patient advocacy organization, educating oneself. I really, commend both the, fathers, they've actually made so much of search and they knew about their children's condition much more better than a regular doctor, I would say. The sort of, kind of search they've made, effort they've taken to educate themselves, family, to find out what are all the treatment, costs, many things they could actually speak so much about. And also as a doctor, he was pointing out, Nirav, I took almost one day, I think 7 to 8 hours to complete all investigation. Then with all investigation backing, I was able to tell them very, very accurately, this is what your child is going through. This is what we can expect. And they're also concerned about uncertainty of vision, uncertainty of child's future. Will my child become a normal like any other? And what would be, these conditions are life-limiting conditions, okay, which we understand it's not easy from the family perspective. But it is, we are in a, we are lucky we are born in Indians. As an Indian, you have a lot of family support. So you have a lot of parental support. Therefore, as Aparna was mentioning, I didn't come out with any family where I have to give a psychological counseling. So what we give is emotional support. Okay, we give a lot of empathy and we guide them where to seek treatment, how to manage. I think most people, they're all close-knitted families. They support each other during the crisis. Those, there are events where child go downhill course, need a repeated hospitalization. And that has been taken care well by these families. Kudos to all these families with the rare conditions, and they have that courage to reach us and find some solution to see a smiles in their child's face. That's what gives them a solace at the end. Thank you, both of you, Nirav and Kalpesh.
Yeah, thank you, Kalpesh ji and Nirav ji, for sharing your experience. I think I would to add a little bit of caution, Dr. Murli, on this thing of that, there is always family support. I think while there is the immediate family support, that family doesn't feel supported by the extended family. We often come across families who really struggling with not feeling supported themselves. So I think there is more that we can do, and I think we need to acknowledge that even if there is family support, the role of counseling and mental health counseling can have, I know it's an expensive option, etc., but I think we should be aware. We've spoken to patients, we've spoken to families, we know that there is a need for it, especially because you're dealing with this day in and day out. You're living with the condition, as I keep saying, 24/7. So I think it's important for families to feel supported and to feel comfortable that they can take, that they can ask for help or seek help either from other families in similar situations as in support groups, or through professionals in that field, because it is a long journey there. So I think we just need to acknowledge that. Thank you once again, all of you, for sharing your experiences. It is always, it's so reassuring to whoever will listen to this that they are not alone, that some others are going through similar situations. And thank you for being so honest and transparent with the issues you and your families face. And thank you, Dr. Murli, for addressing the clinical aspects, but also, dealing with the issues empathetically. So thank you so much.
Thank you very much.